You are welcome to this update. Thank you for coming back. Probably going to just concentrate on the UK in this video because there's quite a few things to say. And then we'll probably do the US as a separate one. Now, there's a big debate going on in the UK at the moment about these lockdown measures. Are they working? Are they not working? To what degree are they working? And then the tiered system, which is coming back in a few days, of course. Is this working? Is this not working? And people are getting very upset about it because if someone's in a restrictive area and someone in an adjacent area is in a less restrictive zone, this has got huge economic, employment, social impact. So you can understand there's a lot of strong feeling about this, and I understand that completely. But to look at whether these things are working or not, we just have to go to the evidence that we have. And we have several lines of evidence. We have the official data from the UK government, which is good, very reliable, and the Office for National Statistics, which is good and reliable, but quite a lot delayed. Then we've got the data from the King's College Zoe app, the COVID symptom tracker app, which is very useful. And we've also got the information from the Imperial College London REACT study, seeing who is testing positive for the virus around the country. So let's start off with the REACT study to begin with. And the bottom line of this is that the overwhelming evidence is that the lockdown measures we've had and the tier system before is reducing the number of cases. And let me just tell you why that's important, actually, before I plunge into the detail. This is why this is important. So I've just sketched out this little graph here. So here we have the number of cases going up this axis here. And then we have the number of weeks going along there like that. Now what happens is, first of all, the cases drop off, then the hospitalisations drop off, and then the deaths drop off because of this lag effect. So first of all, the cases all drop off. Now if the cases drop off, if there's less cases, then less people are going to get sick because the proportion of cases that are hospitalised, there's always going to be a proportion of cases that are hospitalised. So if the cases drop off, then this time scale here is roughly weeks, 1, 2, 3 weeks. So the hospitalisations will drop off in another week or so, a week to 2 weeks, and the deaths will drop off in another 3 to 4 weeks. This is why it's so important that we know this. So what we're seeing now is cases dropping off. Therefore, I think we know that hospitalisations will drop off and deaths will drop off as a result of that. Because the hospitalisations and deaths, of course, only come from the cases. So that's why it's important. And of course, it's also true with hospitalisations. With increasing cases. Hospitalisations will increase as cases increase. And then after that, deaths will increase. So it works both ways with this lag effect. 2 to 3 weeks, 1, 2, 3 weeks for hospitalisations, 3, 4, even slightly more, 5 weeks for deaths. So this is why it's important that we know where we're going. Now this is the REACT study. This is round 7, so they've done 7 tranches of data collection from the country now. This is just for England. Interim report, fall in prevalence of swab-positivity in England during the national lockdown. So the title there is saying that this is having an effect. Check it out for yourself. That's the BBC. I'm not normally a big BBC fan, but that write-up there is actually quite good, and it explains all this in quite interesting, useful terms. So we're talking about the second wave in England. Higher prevalence in the north with lower prevalence in the south was where we were at, sort of end of October to beginning of November. Again, August, September, October, increasing cases in younger adults, then school-aged children, and then older adults. That's the way this wave has sort of developed. Local tiered interventions were in place up to the 5th of November. Then, of course, we had what is now called a lockdown. Now, to be fair, if you live in England, or even indeed the other parts of the UK, I'm sure you realise that this lockdown is nothing like as stringent as the first one was. It's supposed to be, as I understand it, in theory, but we know it's not. There's much more activity going on. So yes, there's a lot of restrictions, but it's nothing like as severe as it was back in March, April. I don't think so anyway. If you're in England, let me know what you think on that. But it's still having a big impact on people's lives. There's no question about that, and it's having a reduction in cases. So it is working, as we're about to see. So this is the React 1 study, but this is round 7 of this study. So we're in round 7 now. A repeated cross-sectional survey of swab positivity. So they're testing lots of people in the country and seeing who's coming up positive. And it's a random sample all over England. Now, you can criticise a few things about Imperial College, and we have, but they do know how to take random samples. So this is a genuine random sample, and that means that the data should be very valid, very highly valid data. Now, the data they're collecting here is for the 13th to the 24th of November. And we're on the 30th of November now. Can you believe it's the end of November already? Quite incredible. But it is. So that is the setup. Now, what about the results? Well, they took 105,000 swab tests. Now, that is a good sample size, especially as it being random. And 821 from all over the UK came back as being positive. And of course, they recorded the precise areas and locations for all this as well, so they could get a lot of regional information. They recorded a lot of demographic information, age-related, ethnicity, socio-economic factors. They collected data on all of that as well. So pretty thorough study if you want to read the whole thing. And I've given you the link already. Now, what they call the raw prevalence was 0.78, and when they adjusted that was 0.96. Now, this is the adjustments they make, taking into account all sorts of things that can affect the likelihood of this being correct. So while that number and that number give you that, this is actually the more accurate figure from their ways of doing statistics. And I read this paper, and while I don't pretend to understand every detail of it, it did seem pretty good. So I'm happy to accept that 0.96 figure of the prevalence. Remember, prevalence is the number of people with the infection at any one point in time. So the number of people in England or Europe or the world with coronavirus today, with coronavirus 2 today, that is the prevalence. The number of people who are infected is the prevalence. Now, so that's the number there, 0.96, and this is the data, remember, that they collected up to the 24th of November. Now, the last round they did, up to the start of November, the prevalence there was 1.23. So you could say, what is the effect of the lockdown? Well, the prevalence has gone from 1.23 down to 0.96. That seems to be roughly what they are saying. And that is actually pretty well a 30% reduction. This is actually quite impressive. 30% reduction to me indicates that there is a cause and effect relationship here. It is the lockdown and the tiered system that has caused this reduction. And because the cases have gone down, we believe that hospitalisations will follow and that deaths will follow, that will also go down. Which of course is the whole point. That's why we're doing this. So the R value as of now, according to this data, or to be more accurate, the R value as of the 24th of November, they estimate to be 0.88. And if it's below 1, it's declining. The numbers are declining. Now, it's not a lot below 1, so they estimate the number of cases will reduce in half every 37 days if we kept up this measure. So it gives a halving time of 37 days for that R value is what they estimate. But having said that, the most recent data, up to, this was just published yesterday, the most recent data shows the R value is probably down to 0.71. So I'd guess that would give a halving time probably down to about 30 days. So has this worked? Well, the figures here speak for themselves. This is what the evidence is telling us. Now, driven mainly by reductions in prevalence in the northern regions. Prevalence among unchanged actually in the Midlands and London. So interesting regional difference here. Now, the prevalence in the northern regions was higher at the beginning of November than the prevalence in the Midlands and London. And yet we've all been subject to the same national restrictions, at least in theory. So you would expect an equivalent reduction in the albeit lower numbers of cases to begin with in London and the Midlands, but we haven't seen this. Strange. So basically we had more cases in the north. Okay, that's gone down, you would expect that. We had lesser cases in the Midlands and London. You would expect that to go down by the same amount, but it hasn't. That stayed roughly the same. So is this showing that these measures are most effective in areas of high prevalence? Can't really tell from the data, but strange. I don't know that there's an explanation for this. You would expect that to go down by the same percentage in the Midlands and London, but that doesn't seem to have happened. Now, whether measures have been taken that aren't as restrictive as the northern regions, that is one possibility. But in theory, it's a national lockdown, so in theory that shouldn't happen. But of course, we do know that a little bit of theory undermines an awful lot of practice in anything that's scientific. So, but that's what this data is showing. So it's been more effective in northern regions where the prevalence was higher. So their conclusion. So we could argue about the Midlands and London where it hasn't been so effective. But nationally, we have got approximately a 30% reduction in prevalence. I'll take that, that's good. Interregional heterogeneity has reduced. Right, hetero means different, doesn't it? So in other words, at the start of this, there was quite high prevalences in the north, lower prevalences in Midlands and London. So if that was the north and that was the Midlands and London, then what has happened is the northern regions, the prevalence has come down, even though the London and Midland ones have stayed much the same. So we've got much more the same levels now. So we're less hetero, we're less different, we're more homo, more the same now. More homogeneity in prevalence rather than heterogeneity in prevalence. It's just the way these people talk. Anyway, that's what that means. Average absolute prevalence remains high at about 1%. Now, this is not saying it's gone away, not by any means. This virus is still highly prevalent in the community. That means that with any restrictions, cases will definitely start increasing again. So this has been a good restrictive exercise, but it hasn't gone away. That's fairly obvious, I think. Certain groups had a higher chance of testing positive. Asian ethnicity. Now, I do wonder there that this is the group that's more likely to be deficient in vitamin D. No mention of that in the study, but there you go. Most deprived neighbourhoods, so lower socioeconomic areas, more testing positive, and largest households testing positive. And we did notice yesterday from evidence from the Department of Homeland Security in the United States that if one person in the household tested positive, then on average in the United States, 53% of that household became infected, became positive. So in larger households, it's not surprising that that would happen, because you'd expect 53% of them, if to extrapolate from the American data, which we can't, but if you did, that's what we would expect, so that's not surprising. So it's estimated that 96 out of every 100,000 people had coronavirus, down from 132 roughly 96 per 10,000 had coronavirus, down from 132 per 10,000 just before the lockdown. So that again is another measure of the effectiveness of the lockdown. About 72,000 new infections a day compared with 100,000 at the end of October. So again, a reduction in their figures. But this is where it gets a bit confusing. So they're saying something like 72,000 new cases per day. What is the COVID symptom tracker app showing? Well, it's showing this number of infections altogether at the moment, but their daily new numbers are 23,000, massively lower. Now, to be fair, the COVID symptom tracker app is just showing symptomatic patients, so we need to add 20% for asymptomatics, but we've still got a big discrepancy in those numbers there. There's no two ways around that. There's quite a big discrepancy, and they're both using good research methodology. So it's been the case all the way through that the imperial data seems to have been more pessimistic, but when you look at the way they're doing these testings, it's good science. So I don't pretend to be able to resolve the difference between these two figures. So let's say about 30,000 new cases per day based on the COVID symptom tracker app. Okay, that's now, but it's only a few days ago that the imperial data was showing 72,000 new cases per day. Bit of a difference. Interesting difference. Now, just to look at the official data. Oh, let's just finish looking at this first. So, I mean, to be fair, both of these studies agree that the trend is very good. The trend is well down. So there's no debate about the trend. There we go. So that's the number of new cases. That's the cases at the moment. That's the prevalence according to King's College COVID Symptom Tracker, Zoe Tim Spector app. That's the new cases. And here's the graph for the reduction in prevalence. And no one's disagreeing with the direction of that graph. Now, going on to the official data. Cases by specimen date. Look at that nice drop off there, and this is grey data. It's not yet official, but it's looking like that's what it's going to be. Although more cases will come as more reporting takes place. So we've got that nice drop off in cases there. Now remember, this is why this is so important. We've got the drop off in cases. That means the drop off in hospitalisations will come. That means the drop off in deaths will come. To use that expression that's been used, this reduction is now baked in because of the reduced numbers. So because of that good reduction in numbers there, we will see reduction in the other things as well. Now at the moment, that is just starting to feed through. So this is the total number of patients in hospital now, and we can see that that curve is just starting to happen now. Now I was on record of saying that height there would not get to that height there, and at least in this wave, and as we see, it hasn't. And the reason I believe that was simply because of this. It's not that difficult, because I could see the cases were dropping off, therefore I knew the hospitalisations would drop off with a week or 2 or even 3 weeks lag. But we are now seeing that hospitalisation total number to start to drop off, so that's good, and that this makes sense for any population, whatever country you're in. Now deaths, again a bit more delay, but the data here is incomplete, but it's looking hopeful that the number of deaths will start dropping off. Now that's deaths by within 28 days of a positive test. So really you can see that the deaths aren't really starting to go off yet. There's still, yeah, and on that graph you can see that graph there is weekly deaths on COVID-19. death certificate by date registered. Of course, there's a bigger delay with the death certificates. So the death certificates, we're not starting to see the delay, the downward trend yet, but that's from the 13th of November. Whereas the more recent data here, which is what date is that? So we're getting dates there from the end of November. We start to see the drop off is occurring already, which is good. So that's the way it's working. Now, of course, when we ease restrictions with Christmas, hate to think about Christmas, cases will go up if people are complying with the more liberal restrictions that the government is allowing. Bear in mind, the government is not mandating it; it's allowing it. But let's just hope people are more sensible about it. Just to finish off, that's the official data website there. Professor Paul Elliott, Imperial College, from the REACT study. Encouraging signs. We agree, Professor. Thank you. Encouraging signs. These trends suggest that the tried approach helped to curb infections in, and that lockdown has added to this effect. So, right, okay, so the tiers are working and the lockdown's added to effect. So the tiered approach had started to work. Double whammy in a very positive direction with the lockdown. Good. As we approach a challenging time of year, well, yeah, that's for sure. It's even more vital that through our actions and behaviour, we all play our part in helping to keep the virus at bay. Hasn't gone away. Remember, it's 1%. And that's a fairly obvious statement about Christmas and the risks. Good. Okay, so I think we'll leave that UK bit there for now. Let's just look at some pictures. Let's look at Christine Coleman sent us some pictures in from Ettlingen in Germany. Do apologise for my pronunciation, Christine. Anyway, thank you for the pictures. Let's have a look at them now. Okay. So good, we've got the message about social distancing there. And it must say it looks very quiet on that particular picture. Does that say weekly market? Vok. Yeah, okay. Anyway, wearing masks is being advised. And have we got 100% compliance? I'm pretty sure we will have. So, okay. That's good. Lots of information here. And again, constant reminders around about the markets and on the streets. Good. So the aim of this was I just wanted to sort of give people the opportunity to express the pandemic for them in pictures. Now, another project I'm going to tell you about is, well, yeah, I'll tell you about it very briefly. So for a long time I've been, these are textbooks I've written. Basically, the plan is, it's quite a big decision really, but I'm going to do a video on this in more detail. But the aim of these textbooks was to get them into the hands of as many people as possible, really regardless of the ability to pay. So this one's all the basic ways that the body works. And every healthcare professional needs to learn this, and many of you will be interested as lay readers as well. And that's the way it goes wrong. And again, these are kind of written as a transition from school into professional life, but that means that the average intelligent reader can read them. And basically, we're making them available free because I want people in poor parts of the country or poor parts of the world really to be able to access them. So they're being made available free as high quality PDFs. But there is a donation link there. I'm not asking for donations, but if you want to download the books and you feel you would make a donation, then fine, that will help us distribute the books in poorer parts of the world and help with various others of my harebrained projects. Okay, thank you for watching as always, and do feel free to download a physiology book and start learning about the amazing way that the body works. And the pathophysiology book, the ways that the body can go wrong and how people study that. Okay, thank you for watching.